Mr. A is a 29-year-old male with a past medical history of type 1 diabetes since adolescence. So you think, okay, type 1 diabetes, do you think his AutoGAD65 antibody, would that be positive or negative? It will be positive, right? We talked about that. We use that to differentiate between type 1 and type 2. So this is, okay, so he got diagnosed when he was in his adolescence. The patient has been out of his insulin for the past 3 days. Today notes that he woke up from sleep with severe abdominal pain, nausea, and vomiting. Upon evaluation in the ER, his glucose was 500, his bicarb was 10, which is low, and his anion gap was elevated. The patient's urine was positive for ketones. His sodium is 123. VBG, which is the venous blood gas, very similar to arterial blood gas, shows a pH of 7.15. We know that the pH is usually 7.4. The patient in the ER was started on insulin drip, and the ER is calling you for admission. What's your diagnosis here, and how would you manage this? This is a very, very common admission to the hospital. You're going to have at least 1 or 2 patients like this on your week. Okay, so on your week on, you're going to have at least maybe 1 or 2 patients coming in with this diagnosis. This is what we call diabetic ketoacidosis, which is DKA. This is more common in type 1 diabetes, and this is how they present. They come in with abdominal pain, nausea, and vomiting. And these patients look very, very dehydrated, and there's a lot of classical things that you can see in these patients.